You could be a victim of Medicare fraud and not even know it. Have you ever been denied when trying to switch your Medicare supplement plan and had no idea why? Or worse, have you ever been diagnosed with a serious health condition that you know you don't have? This is happening more often than you think, and it could cost you thousands of dollars every single year. Today, we're going to break down the most common Medicare fraud scams. We're going to talk about how fraud is quietly increasing your premiums and what you can do to protect yourself, and a few major industry issues you should absolutely be aware of right now. My name is Elisa 𝗵𝗏, and I'm a licensed agent with the Senior Savings Network. Over the past few months, we've worked with many clients trying to switch Medicare supplement carriers due to rising costs, and what we've uncovered is honestly shocking. Here's what's happening behind the scenes. When someone wants to switch Medicare supplement plans, they typically go through underwriting. That means insurance companies review your health history, prescriptions, and medical records before approving you. At our agency, we pre-screen clients carefully. We review medications and known conditions to estimate whether they'll qualify. About 88% of the time, we're spot on. And about 20% of the time, clients are declined and it doesn't make sense. So we dig deeper, and what we're finding is alarming. Insurance carriers are seeing diagnoses and medical records that the client has never heard of. We're talking about heart condition, dementia diagnosis, kidney disease, and other serious permanently declinable conditions. And the client is completely blindsided. These diagnoses become part of your medical record, even if they're wrong. And that can prevent you from switching plans, lock you into higher premiums, and could eventually force you into a Medicare Advantage plan. So how does this happen? It often comes down to Medicare fraud, waste, and abuse. Here are some of the most common examples. Billing for services or equipment you never received. Sending unsolicited medical supplies and billing Medicare anyway. Misrepresenting diagnosis to justify higher payments. Ordering unnecessary tests or procedures. Asking for your Medicare number in unsolicited calls, offering kickbacks or incentives in exchange for your information. Or Medicare Advantage companies sending out nurses to do wellness checks in which they get bonuses for each diagnosis. These aren't small mistakes. These are systemic issues, and they're costing Medicare billions. Let's talk about why this matters to you. Medicare fraud isn't just a government problem. It directly impacts your wallet. It's estimated that Medicare loses over $60 billion every year due to fraud, waste, and abuse. That loss doesn't just disappear. It gets passed down in the form of higher premiums, stricter underwriting, and fewer plan options. This is one of the major reasons programs like 𝗲𝗍 were implemented. And the 𝗲𝗍 program is designed to increase oversight, identify improper billing, and reduce fraudulent claims before they spiral out of control. In simple terms, it's Medicare trying to stop the bleeding. However, this comes in the form of implementing prior authorization in Original Medicare, which is exactly what beneficiaries with Medigap plans are paying to avoid. Now let's talk about a bigger issue happening at the industry level. Some Medicare Advantage carriers, including Elevance Health, have been under scrutiny regarding claims data and billing practices. There have been ongoing concerns and disputes involving missing or incomplete claims data, allegations of upcoding, where diagnoses are exaggerated to increase reimbursement, questions about how risk scores are calculated and submitted to Medicare. Why does this matter? Because Medicare Advantage plans are paid based on how sick their members are reported to be. So, if diagnoses are overstated, even unintentionally, it can lead to higher payments to insurers, inflated overall Medicare spending, and again, higher costs across the system. This ties directly back to fraud, waste, and abuse. Even when it's not outright fraud, inaccuracies in reporting can still drive up costs for everyone. So what should you do if you're declined for a Medicare supplement plan? First, don't panic. Most insurance companies use third-party data sources to review your prescription history and medical records. One of the most common is a report from a company called Milliman. This report shows prescription drug history, indicators of chronic conditions, and medical patterns used in underwriting. If something on that report is wrong, you can dispute it, and you should. Work with your agent to request a copy of the report, identify incorrect diagnoses, file disputes to correct your medical record. This step is critical because if you don't fix it, that incorrect diagnosis could follow you for years and cost you thousands of dollars. We had a client who was declined for her Humana plan end last year. She was declined due to stage 4 chronic kidney disease that she didn't have. She recalled that a nurse came out to her home when she was on a Medicare Advantage plan. This nurse diagnosed her with a condition that she did not have. After 4 months of waiting on hold with her and directing her on how to get this off her record, she was able to dispute the diagnosis and get her Humana plan and approved. Here's how you can protect yourself starting today. Review your Medicare summary notices regularly. Compare services listed with what you actually received. Never give your Medicare number to unsolicited callers. Be cautious at free medical events or screenings. Understand how your plan uses your information. And if you suspect fraud, call 1-800-MEDICARE or report it online at medicare.gov. If you're in a Medicare Advantage or drug plan, you can contact 𝗍-MEDIC. Here's the bottom line. Medicare fraud doesn't just affect the system, it affects you. It can increase your premiums, limit your options, and even trap you in a plan you don't want. And with projections showing Medicare facing financial strain in the upcoming decade, this issue isn't going away. We all have a role to play in protecting your healthcare system. If we stay informed, ask questions, and take action when something doesn't look right, we can help protect Medicare for ourselves and future generations. If you've been denied coverage, notice something unusual on your records, or just want a second opinion, reach out. We're here to help you navigate this and find the best options available. If you found this video helpful, make sure to like and subscribe and comment any questions below. My name is Elisa 𝗵𝗏, and we'll see you in the next video.